Welcome to Take a Minute. I'm Noemi, and in these stressful times, I'm here to share some tips with stay-at-home moms, working moms, and everything in between moms. In this week's Take a Minute, let's talk about PTSD Awareness Month. June is National PTSD Awareness Month, and PTSD Day is observed every year on June 27th. PTSD stands for Post-Traumatic Stress Disorder and affects millions of Americans. Here are some basic facts about this mental health disorder. What is PTSD? PTSD is the result of experiencing or witnessing a traumatic event. While most often associated with combat and combat-related military service, PTSD is not limited to those who served in the military, and not all who served will develop symptoms of PTSD. Some statistics. Some sources estimate that as many as 70% of all Americans have experienced a traumatic event sufficient enough to cause PTSD or PTSD-like symptoms. In raw numbers, some 244 million Americans have experienced a traumatic event, and out of that number, 20% will develop PTSD symptoms. That would be about 44 million people. Out of that 44 million people, 8% will experience active PTSD symptoms. An estimated 50% of all mental health patients in the U.S. are also diagnosed with PTSD. PTSD, misunderstood and misidentified. Phrases such as shell shock and combat shock were early attempts to define and understand PTSD. It isn't until 1980 when things began to change, and PTSD was recognized and listed in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. PTSD today. The symptoms of PTSD are better understood, treatable, and recognized by the Department of Veteran Affairs. Although this condition is not exclusive to members of the military, it is recognized that a portion of those who serve in the military, both veterans and active members, are at risk for PTSD. Symptoms for PTSD. It is important to remember that there is no one-size-fits-all diagnosis for PTSD. Some symptoms are considered red flags when associated with PTSD, while other symptoms are more nonspecific and can be attributed to other mental health issues. Symptoms for PTSD include repeatedly experiencing the traumatic event in the form of flashbacks, nightmares, persistent memories of the event, intrusive thoughts about the traumatic experience, and, as in the case of those who serve in the military, hypervigilance, which is a state of increased alertness, and hyperarousal, which is when a person's body kicks into high alert as a result of thinking about their trauma. Incidentally, this last one is a primary symptom of PTSD. Help for those with PTSD. Those who experience PTSD or PTSD-like symptoms should seek help immediately. The Department of Veteran Affairs has medical facilities, private care providers, counselors, and therapists available to provide an initial care regimen that can be helpful to those who suffer from PTSD. For more information on PTSD, visit our website at www.mcallenlibrary.net for a list of books available for checkout at the McAllen Public Library. And this is Take a Minute. This has been Take a Minute. I'm Noemi with the Palmy Branch Library, asking you to take a minute to take care of yourself so you can take care of your family.